So understanding safety and emergency care skills within the nurse aide range of function. So you must hold a healthcare provider BLS or basic life support card. This can be obtained through local fire departments. It can be obtained through the American Heart Association. And you have to be assessed for skill retention prior to your clinicals. So of course you guys can all imagine that an ounce of prevention is worth a pound of cure, which means that if we prevent things, oftentimes we prevent a problem from occurring, which means we wouldn't have a problem on the other end. So for example, if a patient's getting ready to fall, if we ensure that they're placed in the bed properly, they have their call bell, and they have the things that they need, we can actually prevent the fall if one of those patients is trying to get up. So the National Patient Safety Goals, or NPSGs, for long-term care identify residents correctly is number one. Number two is to use medications safely. As a nursing assistant student or as a nursing assistant, you will not necessarily be given medications. Number three is to prevent infection. Number four is to check residents' medications. Again, you will not be doing that. And number five is to prevent residents from falling, and number six is to prevent bed sores. So how do we identify a resident correctly? You have to use at least two ways to identify them. For example, their name and their date of birth, or the last four digits of their social security number. Just because you've taken care of them doesn't always mean that you can just say, hey, I've taken care of Mrs. Jones, so Sue, I can tell you the patient in bed 10 is Mrs. Jones. All right, so always, always, always check the armband of the patient and ask them to give you their name and their date of birth. So we have to ensure that we have the right resident so that we provide the right care to the right resident. We use identification bracelets, as you can see in the pictures, and we ask the patient, the resident, to state their name. We can also use ID systems that involve photographs. So a lot of times patients' charts in long-term care facilities are at the nurse's station, and they have a picture of the resident in the chart. So also realize that care to the wrong resident can threaten their life. So use hand cleaning guidelines from the CDC and prevention of or World Health Organization. So how do we prevent residents from falling? We have to find out who's more at risk to fall. For example, residents taking medicines that might make them weak, dizzy, or sleepy, like Benadryl, like pain medicines. We have to be very judicious and ensure that these patients don't fall. So some of the greater risks that our patients may have or residents may have which make them more at risk for falls are things such as age-related factors. So the elderly are more frail, so a lot of times their vital signs are lower or higher, and they're at risk. Awareness of the surroundings, you can actually have things that get in the way. Decreased vision, impaired hearing, decreased ability to smell, decreased sensitivity to touch, immobility, and some medications. So you need to make sure you report observations to a supervisor that lead you to believe that a resident is prone to fall. If you go to the doctor's office at any point in time these days, you actually will see a sign in the room and it says, "Call, don't fall." So falls account for 70% of accidents in healthcare facilities. So we need to make sure we answer call signals promptly and keep frequently used articles within the reach of the resident. There's nothing worse than wanting to pick up your eyeglasses off of your bedside table only to find that they're at the desk and you can't get up to get them. So other ways to prevent falls is to lock brakes on movable equipment such as wheelchairs, stretchers, mechanical lifts, beds, and yes, commodes. Properly position our residents in the bed and in the wheelchair. Observe no lift or limited lift policies to prevent falls and injury to residents and nurse aide assistants. Report any facility structure hazards immediately that could lead to a fall, such as frayed carpet, loose or broken side rails, or lights that do not work. Next patient safety goal is prevention of bed sores. We have to find out which residents are most likely to have bed sores and take action to prevent those. And we will actually discuss bed sores in Indicator 5.02. So general safety rules. Walk in the halls and on stairs and don't run. That makes you prone to falling. Keep to the right-hand side of the hall. Just like when you're driving, you drive on the right-hand side. Approach swinging doors with caution. Use handrails going up and down stairs. Keep halls and stairs free of obstacles. Check labels on all containers prior to using the contents that are inside, and wipe up spilled liquids immediately. Pick up any litter and place it in the proper container. Follow the instructions of your supervisor for patient or resident care. Report injuries immediately. Never use damaged or frayed electrical cords. If something is frayed or damaged, make sure you tag it and take it out of service. Report broken or malfunctioning equipment immediately. Check linen for personal items contained in folds prior to sending it to the laundry. So lots of times we lose hearing aids. Residents take their hearing aids or their dentures out and they end up in the bed. This also happens with glasses. Report any unsafe conditions immediately. Ask for an explanation of things that you don't understand. Don't assume. She may be in the office. You can knock on the door and see if she's in there. Sorry. So elevate side rails for residents. So I'm going to hit you because I'm recording a lecture. And now you're in my statewide lecture. Yes, I am. So elevate side rails for residents at risk of falling per the facility's policy. So age-related factors that increase risk of injury are decreased strength, slower movement, difficulty maintaining balance, tremors that can affect balance, awareness of surroundings. Some residents are totally unaware, such as those who are unconscious or that are comatose. Some suffer from dementia. Those residents could be confused or disoriented. Decreased vision in our residents mean that they have difficulty seeing objects and they're in danger of falling or tripping because of that decreased vision. And they also have difficulty reading labels and containers. So hearing impaired residents may not hear warning signals or alarms such as a fire alarm. They may not hear approaching equipment. Some other factors include smell and touch. Reduced smell means that oftentimes our residents are unaware of smoke or gas fumes, and they may have decreased sensitivity to heat or cold and become easily burned. So inability to move independently, crippling diseases such as arthritis and paralysis increase risk of injury. Medication can also affect balance, reduce awareness, cause confusion or disorientation, cause drowsiness, affect coordination, and make residents fearful and uncooperative. So now we're going to move into preventing burns. Burns are the second most common hazard to our residents. One of the ways that they get burned is, believe it or not, bath water. So make sure you check the temperature in the bath or the shower with a bath thermometer or with your hand. It's very easy if you put the very end of your wrist, the inside of your wrist, and touch the water because that is a very sensitive area, and you can check temperature that way. Water temperature should never be hotter than 105 degrees. It is important that you remember that number, 105 degrees Fahrenheit. Residents must verify that the temperature of the water is comfortable or not, and that it is comfortable to them. Report areas where water temperature seems too hot. We also need to make sure we monitor smoking practices. Some of our elderly residents smoke, and we have to make sure that they are not smoking in bed, smoking in bathrooms. When bathing a resident or providing a soak, ask the resident to feel the water first and verify the temperature is comfortable. Provide assistance at mealtime to ensure that they don't spill hot liquids on themselves, which could burn them, and use facility equipment according to written policies. We also have to monitor use of electrical appliances used by our residents. Avoid overexposure to sunlight. Sunburns are painful. Let's move on to preventing poisoning. So we need to store toxins in locked cabinets and away from resident areas. Never leave toxic products where they might be ingested. Have identifying labels on all containers and never use unlabeled substances. So let's go to choking. Encourage your residents to use their dentures when they eat. Cut food into small pieces or assist them to cut the food into small pieces. Report any difficulty when our residents are swallowing. So this is a huge thing. Please ensure that the head of the bed, or HOB, is elevated before attempting to feed a resident. This helps with their digestion and helps us to ensure that they do not aspirate their food. Residents with feeding tubes usually have the head of the bed elevated at 30 to 45 degrees. Be certain the resident has swallowed before you continue to feed them. A lot of times our elderly patients will pocket food inside their buccal membranes in their mouth. Residents with feeding tubes should never have the bed flat for extended periods of time. Follow instructions regarding the resident's position to prevent them from aspirating. Never leave our residents unattended in the bathtub. Immediately transport from areas where smoke or gas fumes are noticed. Properly apply and check vest restraints and safety belt restraints. How do we prevent spread of microorganisms? Wash your hands before and after care. It's important. Follow standard-based and transmission-based precautions. So how do we prevent other injuries? Move equipment around corners with caution. Be careful of residents' feet, hands, arms, and elbows when we transport them in wheelchairs. They can get banged. Monitor residents who wander away. Follow instructions when you provide care, and keep the bed in the lowest position except when giving bedside care. That means when you're standing beside the bed should be at a level for your comfort, and then you need to make sure you put the bed back in the lowest position when you leave. Use night lights in rooms. Have residents wear shoes and slippers with non-skid soles. Check crutches, canes, and walkers for non-skid tips. Keep the call signal within easy reach. Report immediately any observations indicating the resident is a danger to himself or others. So body mechanics, this is a repeat for Health Science 2 for most of you. So body mechanics is the coordination of body alignment, balance, and movement. Job requirements for nurse aides include lifting, moving, and transferring resident, and lifting, moving, and carrying objects. So the purpose of good body mechanics is to maximize your strength and minimize fatigue. Also to avoid muscle strain and injury and assure personal and resident safety. Never bend over from the waist to pick up an object. Lift firmly and smoothly. Keep the object close to the body and keep your back straight. Bend at your hips and your knees and get close to the object prior to lifting. Grip objects firmly with both hands and lift by pushing up with strong leg muscles. Get help if an object or resident appears to be too heavy. Keep your feet apart to provide wide base of support, which means they should be parallel or even with your hips at a minimum. Pivot or turn with your feet. Use short steps when you turn. Turn your entire body without twisting at your back and neck. Pull or push when possible instead of lifting, and use your body weight to help push or to pull. When reaching for an object, evaluate the distance. Face in the direction you are working to prevent from twisting. Adjust beds to waist level when you provide resident care, and be sure your body is in good alignment at all times. We are going to move into fire safety. This is also a repeat from Health Science 2. So we are all responsible for preventing fires, and you are responsible for knowing what to do. Major fire hazards include faulty electrical equipment and wiring, overloaded circuits, which there's a picture, plugs not properly grounded, and clutter. Unsafe practices when oxygen is in use, smoking, and spontaneous combustible materials. So the elements necessary to start a fire are fuel, material that will burn, heat is the flame or the spark, and oxygen. Fire safety activities can be to learn and to locate the escape routes and fire escapes, use of all fire control equipment such as fire doors, sprinkler system controls, fire extinguishers, and fire drill procedures. Fire safety activities can be an awareness of all the hazards and report them immediately. So watch for frayed electrical wires, never overload circuits, use 3-prong grounded plugs, never use extension cords, and control clutter. Dispose of rags properly, empty ashtrays and metal containers, not paper or plastic, empty waste baskets in proper receptacles, report any odors of smoke or burning, and please keep all the fire exits clear. So smoking is limited to specific areas. It is never allowed in the bed, and let's make sure we have large ashtrays available. Most facilities are smoke-free, and they have a designated smoking area. So when patients smoke, we need to observe the use of matches and lighters and directly supervise residents when smoking as needed. In the event of a fire, stay calm as you race. Race means remove residents from immediate danger, otherwise defend in place. Activate the fire alarm. Confine the fire if you're able by closing all windows and doors to choke off the oxygen. Extinguish if you can, empty the extinguisher. Carry upright the fire extinguisher, and then pull the safety pin. Aim at the base of the fire, squeeze the handle down, spray in a sweeping motion at the base of the fire. Relocate residents per evacuation policy if you are directed to do so. Remember these important guidelines. Shut off air conditioning, shut off oxygen, shut off the lights, and never use the elevators. Oxygen safety. Never have open flames or smoking in an area where you have oxygen. Remove flammable liquids from areas and do not use electrical equipment in those areas. You always need to make sure you post an oxygen in use sign. Remove cigarettes and matches from the room. Use cotton, blankets, and clothing. Wool is flammable. Do not let the resident's nasal cannula touch the floor. Pathogens on the floor will contaminate the cannula. Now let's talk about disasters and catastrophes. So we can have disasters of natural origin such as a flood, an earthquake, a hurricane, or a tornado. Human disasters can include airplanes, buses, trains, explosive nuclear wastes, and blackouts. Healthcare is impacted by verbally and sometimes physically abusive patients and families and visitors. This is as we move on to workplace violence, which is a disaster for us. Verbal abuse often goes underreported or unreported as it's thought to be just part of the job. 90% of nurses are assaulted on duty during their career. The majority of healthcare worker violence takes place on evening and night shifts. Facilities are required to have a disaster plan. Responsibilities in a disaster: remove residents from immediate danger and report to facility and follow directions for your role. Know your facility's disaster and assist with evacuation. Help remove and secure equipment, supplies, and records. Think before you act and don't waste time. You must remain calm in any disaster. Carry out your responsibilities confidently. Medical emergencies. The choking resident. Choking occurs when the throat is blocked or closed up and air cannot get to the airway. The airway may be blocked by food or liquids. Meat or a bone are most common. Blood or mucus, foreign objects including the tongue, and vomit. So if a victim is coughing, do not intervene. Stay close. Encourage them to cough, which is a way for them to dislodge the obstruction. Never slap a coughing resident on the back. It can actually cause whatever's in there to fall lower. Signs of severe foreign body airway obstruction are the person is unable to speak, there is no air movement, or they are grasping their throat, which is the distress signal. Abdominal thrust, chest thrust, and back blows are effective for relieving severe foreign body airway obstruction. To treat the choking resident, tilt the head back in an unconscious person may clear the airway since that pulls the tongue forward. Signs and symptoms of a heart attack: chest pressure, fullness, squeezing, or pain in the center of the chest behind the breastbone or spread to either shoulder, neck, jaw, and the arm, usually lasts longer than a few minutes, and it comes and goes. Fainting, sweating, nausea, shortness of breath also occur. If you are certified in CPR, offer assistance. If not, get out of the way. In the event of an emergency, seek assistance in the facility. Use the emergency light, use the call signal, send another resident for help, or yell help. In the home or at an accident scene, dial 911, give the location, phone number, type of emergency, number of people needing help, and relate the requested information. I don't have any room for it. It's been sticking in the closet with our equipment. We don't have room for it. I don't know if we have any other use for it. That has to be sent to Miss Tobias. I mean, that closet's been used as storage, and we can't get equipment out. You know what? Just take it and stick it over in that corner right now, and I'll address it with Miss Tobias. Because I don't know what else to do with it. I mean, we just don't have room. So if you stay calm with the 911 communicator, it's much easier and faster to get help. Agencies that provide CPR curriculum are the American Red Cross and the American Heart Association. Typically, most facilities want you to have American Heart. You must be trained to administer CPR unless you are doing hands-only compressions. Activate the emergency medical system or your facility's plan. CPR must be started immediately to be effective. Follow the facility policy for advanced care directives. So if your patient's a DNR, do not start CPR. Methods to administer CPR: there is one-person CPR and two-person CPR. Convulsive disorders: there are many causes that could be from an infectious disease, medication that wasn't given, a head injury, a stroke, or seizure syndrome. Types of seizures are partial, general, or unclassified. A general seizure can be a grand mal or a petit mal, which is an absent seizure. What you need to do is summon help, stay with the resident, protect them from injury by lowering them to the floor, remove objects out of the way that may cause them injury. Do not restrain them or put anything in their mouth. If you can, loosen constrictive clothing specifically around their neck, place a pillow under their head, and turn their face to one side in case they vomit. Note the time and type of seizure. Provide rest for the resident after the seizure. They are very tired, confused, and often they're disoriented. So if someone faints, fainting is caused by temporary reduction of blood to the brain. Early signs and symptoms include dizziness, decreased pulse and blood pressure, pallor and perspiration, nausea, cold skin, numbness, and tingling of the extremities. Make sure you summon help, stay with the resident, have them sit or lie down, loosen tight clothing, position the head lower than the heart. Sitting, they can put their head between their legs, or lying down, elevate the legs. Monitor pulse and respirations, and have the resident rest for 5 to 10 minutes before moving. Once you get them moving again, have them move slowly. Provide a blanket if they're cold. Causes of shock can be from severe injury, excessive loss of body fluids, pain, respiratory and or cardiac arrest, anxiety, low or falling blood pressure, weak, rapid pulse, cold, moist, pale skin, rapid respirations. Patients also have thirst, they're restless, they're confused, and oftentimes they have a loss of consciousness. What do? Summon help, stay with them, keep them in a laying down, control any bleeding if they have it, and keep them warm. So hemorrhage, there are two types, internal and external. Signs and symptoms of internal: pain, shock, which we just talked about, vomiting blood. This does not mean a little strand of blood when they cough. This means big clumps. Loss of consciousness. External can usually be seen. Internal, you need to summon help, stay with them, keep them warm, flat, and quiet until help gets there. External hemorrhage, summon help, stay with the resident. Identify the location of the bleeding and apply continuous direct pressure. If bleeding is not controlled, apply pressure over the artery above the bleeding site. If no pain or broken bones, elevate the wounded area above the heart while maintaining pressure. With external hemorrhage, keep the resident comfortable, warm, and quiet until help arrives. When you report an emergency, make sure you never panic and stay calm. Take a few slow, deep breaths, observe your surroundings, assess your resources that are available, evaluate your situation, such as the victim, the safety of the environment, call or send for help, and determine treatment priorities. Report emergencies accurately. If help is not available, contact 911, the police, the fire department, the telephone operator, or local EMS. You make sure you report accurately by saying your name, the location, the description of the scene, information about injuries, the type of help that's needed, and the number of people that need your help. Know your limitations, provide care and reassure victims, and keep bystanders away from victims. And this ends 3.02, Understanding Safety and Emergency Care Skills within the Nurse Aide Range of Function.